Hi, everyone. My name is Zoe,
I'm Isabel.
And I'm Kylie.
and we did our project on food allergies. Okay, perfect. So, to start off with just some statistics, I'll just read off a few of them. About 40% of children with food allergies are allergic to more than one food, which I feel like is kind of a high percentage. It's kind of concerning. And then in the US, about 27 million adults have food allergies, and around 5.6 million children have food allergies as well. And more than 40% of those children with food allergies and more than 50% of adults have experienced severe allergic reactions. And anaphylaxis, I think is how you say it, is one of them. Milk and peanuts are actually the most common allergies across the US. And I mean, I know people who are allergic to both of those. I feel like we probably all know someone. And then the CDC concluded that between 1997 and 2011, the prevalence of food allergies in children went up by like 50%, which is a lot. And I don't think we know the reason for that either. And then the last statistic we have is in the US, there are 200,000 people that require medical attention every year for allergic reactions to food. And then these were just some like graphics we had for other statistics. I won't read them off, but I thought they were pretty good graphics. So you can look at those.
Okay, food allergies is a medical condition in which the immune system reacts abnormal to certain slash specific foods. Oh, okay. Sorry, I'm fixing my screen. Okay. The immune system attacks the proteins in the trigger foods that are normally harmless. Even a small amount of the allergy-causing food can give an allergic reaction that can range from mild symptoms to even being life-threatening. When someone has a life-threatening reaction to certain foods, this is known as an anaphylactic allergy or allergic reaction, meaning a very serious reaction that happens usually within minutes or even seconds from the exposure. As someone who has many anaphylactic food allergies, I can say that it is very scary when I accidentally consume something that has certain ingredients in it or even has had cross-contamination. I immediately start to feel my throat and esophagus become tight, my ears start to itch, I can't swallow, and I have difficulty breathing, and before I know it, my throat has started to close. Serious food allergies can cause people like myself to live with food anxiety because of how easy it is for us to go into anaphylaxis. We get so scared of trying new foods when we go out or when someone cooks for us because of how simple it is for cross-contamination to occur. Food allergies have also been linked to eating disorders. People with food allergies who are constantly reading food labels and worrying about what they are eating can cause our brains to become intimidated by food, causing them to eat less or associate food with pain. And then on this slide, I included just common misconceptions. Having food allergies and having an intolerance to a food/food protein are very different. People commonly misuse the term of being allergic because of the similarity the symptoms can have. Due to the incorrect use of people claiming they are allergic to some foods, it causes some people in restaurants to not take food allergies as serious or to be as careful. This can result in someone having a bad allergic reaction due to cross-contamination. And in this picture, it just explains the difference, but also the similarity of how like a normal food can still affect someone with an intolerance, but also someone with an allergy, just in different ways. Okay. Allergic reactions caused by food vary in severity. There are mild allergic reactions such as developing a rash, hives, or facial swelling. Then there are more of the severe and life-threatening allergic reactions. These severe reactions consist of throat/esophagus swelling and having trouble breathing and/or swallowing. This type of allergic reaction is also known as anaphylaxis, which is very dangerous, painful, and can lead to death. Sorry, I'm fixing my screen again. Other symptoms such as itchy tongue and mouth, coughing and wheezing, abdominal cramps and diarrhea, and vomiting are all vary in severity depending on the person's level of intolerance to the food they are allergic to. When someone is experiencing a mild reaction to food, they can take Benadryl to calm the reaction and make the hives, itching, and/or swelling in the face or mouth become more tolerable. When someone is having a severe allergic reaction, they may need to use an epinephrine EpiPen and then seek medical attention via ambulance or emergency room. If someone is having an anaphylactic reaction at the hospital or in an ambulance, they will be injected with epinephrine to onset the symptoms and discomfort. Food allergies cannot be cured, but they can be treated. People with known food allergies can follow an elimination diet where they eliminate the foods that they are allergic to. The elimination diet is the most effective way to avoid allergic reactions to food. Elimination diets are different per each person, as there are many different types of food allergies that someone could have. And then these are just pictures of the body part and the symptoms that can occur with food allergies. And this part points to the internal reactions that could happen.
So then for diagnosis, most of the time a food allergy can be obvious because there's some sort of physical consequence like hives, a rash, sneezing, or any sort of other reaction. If not, people will go see a doctor and they'll ask for medical history, symptoms that you've had, if any. And some of the tests that work are skin and blood tests, but unless there's been a reaction in the past, the skin or blood test may or may not work. And then an allergist is someone who decides what allergy tests to conduct if necessary and what foods to avoid, kind of like process of elimination. Kylie mentioned the elimination diet, and they'll conclude what food allergies that you have and just how to move forward. If not, doctors might also feel the need to conduct further testing. And it's also really common to have more than one allergy test because you really want to make sure that you're avoiding the foods you need to avoid. So to go into further detail about the tests, skin testing is pricking the skin on your arm or your back. And if a wheal appears, which a wheal is like a mosquito bite-like thing, and if that appears, then you're most likely allergic. And these take like 15 to 30 minutes. And I kind of thought of like the COVID tests, how like there's a rapid one where it'll take a few minutes, 15 to 30 maybe, and then there's like PCR, which will take a few days, which is like blood testing, takes 1 to 2 weeks, and it measures the amount of IgE antibodies, and that's immunoglobulin E. I don't know if that's how you pronounce it, but that's what that stands for. And those are antibodies that are only found in mammals. And it's just reported as a number to let you know how many antibodies there are, and it'll tell you if an allergy persists in your body. And then there's the oral food challenge, which is the most effective, but it's also the most dangerous because you're essentially eating the food that you're probably allergic to or might be allergic to. It can also be expensive and time consuming, and medical care has to be on standby at all times if you're doing the oral food challenge, just in case of an emergency. And it also works to see if you've outgrown an allergy too, which is nice, but also scary because it can be dangerous.
Okay, so there's actually quite a few types of food allergy testing. So these are a few more. Elimination diet was already mentioned. And then it's common that when you are implementing this diet, you eliminate like a specific 6 foods, which are eggs, soy, cow milk, wheat, seafood, and then peanuts and tree nuts, because those are like the 6 most common allergens. And then a pro of this diet, it can diagnose EOE, which is like inflammation of the esophagus, which is like a common allergic reaction that most people have to these 6 allergens. And then a con is that it can lead to nutritional deficiency if used long term, because like obviously these foods are very rich in nutrients and can be essential to like having a diverse diet and making sure that you get all these nutrients. So when you don't have all these, you are going to have to supplement other foods in to make sure you are getting those nutrients that are so important to your long-term health. And then an intradermal test is where you inject the food allergen into your skin. And the pro of this test is that it's highly sensitive for IgE, which is like the immune system reaction, like Zoe was talking about, that determines food allergies. And then a con is that if it's not performed due to high risk, it's not performed due to high risk anaphylaxis. So they are hesitant doing this test because there's a large chance that you'll go into anaphylaxis. So that's why they're pretty conservative doing the intradermal test. And then another type is hair samples. Some certain labs are able to determine what foods you're allergic to based on your hair, which is interesting. So these are just a bunch of pictures of testing examples. You can see like all the circles around each intradermal test, and then the girl with the sticky stuff on her back, that's called a patch test, where it's like adhesive lined with the allergen to see what kind of reaction she has. So yeah, there's a bunch of different tests you can do to weed out certain allergens. So as you might suspect, there's tons of research done about food allergies, many of which have dated years and years back, and then there's a lot of recent ones that are showing like new data that are really helping us inform decisions we're making in public health and in medicine. So the first one is the prevalence and severity of food allergies among US adults. And this was a study conducted with 40,000 adults in the US, and then a whopping 10.8% had allergies, and then 19% believed they had allergies, which means they had some adverse reaction to food, to certain kinds of food, but they might not actually show up on a test as actual allergies. And then 50% had an adult onset food allergy, which is such a large percentage to me, because you think of children developing food allergies in childhood, not adults, but this proves that 50% had adult onset food allergies, and then 38% had been to the ER due to a food allergy, which is a large percentage also. And then number 2, the public health impact of parent-reported childhood food allergies in the United States. This one was interesting because it showed that 11% of children were perceived as food allergic, which, and this article just went into depth about how parents, like especially first-time parents, can be like so like hyper fixated on everything that their children are eating and like how they're reacting to it. So it went on to talk about how the perceived disease burden is like becoming a problem in the United States. Like, and parents kind of just need to like take a step back and like let their children's immune system do their thing before they like think that their kids are allergic to all these foods. And then number 3 is food allergies and intolerances, a clinical approach to the diagnosis and management of adverse reactions to food. So this test was interesting because it showed this huge chart of all of the different symptoms and side effects that people have from food allergies, and it's pretty much every single symptom you can think of. And then it went on to describe certain tests, which we mentioned before, like the oral food challenge, which is where they just increase the allergen dosage until the subject reacts. And it's a pro of the study is that it's a double-blind study, which means the subject and the researcher, neither of them know what the allergen is, so that makes it a gold standard and very unbiased. And then a con is that it's expensive, it's inconvenient, you have to do it in a lab, and there's obviously the potential for severe allergic reaction. And then another test is patch testing, and that's the picture that we saw before with like the sticky things on the girl's back. It's like chambers lined on adhesive tape, and then the allergen is applied to the adhesive, and then it's applied to the skin, and then they check back on it 48 to 72 hours later to see if the skin has reacted at all. And then it can evaluate triggers for EOE. And then con is that it's primarily used in research settings, which means it doesn't lend itself to be done at home very easily. And then beyond avoidance is the psychosocial impact of food allergies. This one was really interesting because it talks about like how hard it is for children to grow up with food allergies, because if you think about it, pretty much all events in a child's life revolve around food, like school lunches and play dates at friends' houses and birthday parties with cake and going out to eat with your family, like, and all of these things have to be taken into perspective in this when you have a food allergy. And so this impact on these kids' minds can be detrimental sometimes. And then solid food introduction in the development of food allergies. This article showed that several studies have found that delayed exposure to allergenic foods did not reduce the risk of food allergies. So this is like believed that if you like wait to introduce certain foods to your children, like their immune system will be up and they won't be allergic, but it was kind of debunked in this article, and there's like no need to wait to introduce foods. I mean, past 4 months, like you should wait 4 months. But it said that infants should be introduced to foods that are eaten in their culture and within their families at 6 months. And then the last one is, it's not just the food you eat, environmental factors in the development of food allergies. And this talked about how secondhand smoke, excessive exposure to advanced glycations, which are end products derived from dietary sugars, and then cooked meats, oils, and cheese, and then limited vitamin D exposure, all can have an impact on children's food allergies. So it's not just what you eat, it's like also like what you surround yourself with. And then this is just a chart explaining how the psychosocial effect of food allergies and how that can impact a child in their life, like depression, anxiety, PTSD, bullying. So all of these factors have an impact, and they all come from diagnosed food allergies.
Okay, My roommate is vacuuming upstairs, so if you guys hear that, just don't mind it. Um, so for nutrition with food allergies, one of the most important things is to introduce allergenic foods as early as possible. So a lot of people start weaning their babies around like 6 months, which is really just when you start introducing foods other than like breast milk or formula. Um, and this was already said earlier, I believe, but the most common food allergens are milk, eggs, fish, shellfish, tree nuts, peanuts, wheat, and soybeans. So, just like making sure to introduce those at an early age is really important because it could help to build their immune system or just immunity to the allergy like reactions. This does have to be done with care and caution though, because they could have an allergic reaction to it, which could potentially be really severe. Um, and then some nutrients, some of the like main nutrients that help build the immunity and prevent allergies to especially these foods would be vitamin D, zinc, essential fatty acids, and pre and probiotics. And vitamin D is typically known for like calcium and bone health. I feel like we've all heard that our whole lives. But it also enhances specific responses to macrophages, which are just like special cells that find phagocytosis, I think is how you say it. And it can help destroy any harmful bacterias. I really don't. Can you guys hear that? Okay. It's a lot louder than I thought it would be. But then zinc strengthens your antioxidative barrier. So it just like protects cells from damage of like free radicals. And then essential fatty acids help with skin irritation. So like if you're one to break out in hives or get a rash or something, fatty acids would help prevent that or help it. And then pre and probiotics help with intestinal issues. So like I know a lot of people drink like kombucha or something because it has like live probiotics in it that help gut health, whether it's for allergies or not. I just know that that's like one example. And then basically overall, the less restrictions on food, the better, especially at an early age, because then they're exposed to as many items as possible. And overall, it'll just improve nutritional intake and overall quality of life in the long run.
Okay. Sorry, fixing my screen again. When someone suffers from food allergies, they have a unique diet that they eat a certain way that pertains to their body. There are many different kinds of food allergies that someone can have, and not everyone who has food allergies are allergic to the same things. The most common foods to be allergic to, as mentioned previously by like all of us, are dairy, eggs, soy, gluten, wheat, peanuts, tree nuts, fish, and shellfish. After someone has tested positive for food allergies and when they are first diagnosed, they are typically advised by their allergist to follow the 8-food elimination diet. Although they have already gotten tested, not all food allergies can show up positive. There can still be unknown triggers. This is why the allergist usually suggests someone to start off with taking out all 8 to see if their symptoms improve. And they only usually do that if you're having like random anaphylaxis like symptoms, or you're having struggle like breathing, or you're choking and stuff. They don't normally do that if just somebody's breaking out in hives. And after about 6 to 8 weeks of following the strict diet, the doctor has the patient come in for a follow-up. They will then discuss how the patient has been feeling and if they think it is a good idea to slowly introduce one of the foods that didn't come back positive back into their diet. Figuring out the best diet for someone who has food allergies can be a long and overwhelming process, as it can be very difficult to figure out exactly what foods are causing the immune system to have these allergic reactions. After someone has figured out what diet works best for their bodies, they are then typically referred to a dietitian to figure out what foods they can eat, what recipes they can cook, and how to be on the lookout for what may contain their trigger foods. The dietitian is there to help and make sure the person is following their diet to their best of their ability, while also making sure that their body is getting the nutrition and the right amount of calories that they need. And this is just a picture of what the top 8 food allergens look like. And it goes into detail about how they can switch and replace dairy or soy. And then I also did the 5-day menu. I kind of based this off of my diet first, versus like a random diet, but I did mine, which is I'm allergic to dairy, eggs, soy, shellfish, and just fish in general. And I also eat very small amounts of gluten because I'm gluten intolerant. So I just based this diet off of something that I would possibly eat or something that like my daily diet looks like. So for example, for breakfast, some days I'll have 1 cup of vanilla almond milk yogurt with topped with like fruits or sometimes oats or whatever I'm just feeling that morning. And then I'll usually have water afterwards. Sometimes I'll have coffee. For snacks, I'll have a Larabar, which is like a vegan breakfast bar, or like they make different types of bars. And sometimes I'll have sliced apples with peanut butter. And whenever I'm lacking calories or I haven't ate that many calories, I'll have a Cape Farms chocolate flavored meal replacement drink, which I'll have several times throughout the week, because if not, I'm low on like 400 calories. And these drinks are fueled with many vitamins and calories and accommodate to every type of allergy. Sometimes I'll have like spinach ravioli and marinara sauce. Snacks can be different as well. Like I'll have carrots or whatever vegetable and hummus. And then for dinner, you can find like vegan vegetable sushi and then white rice and broccoli. And then this kind of just carries on throughout the presentation. I just have different types of meals. I really switched it up and made sure to not repeat anything. I'm not really going to read them all, but I will flip through them. And with each meal, I did make sure to include how many cups of water, how many cups of like almond milk I'm having, or whoever is following this menu is having. And I also did specify the amount of like tablespoons and teaspoons, just so that we can get a better idea of exactly how much nutrients whoever is eating this diet is consuming. I think either Isabel or Zoe did the references page, but this is kind of like all of the links we've all used combined, and it's in MLA format.
That's it. Hope you guys enjoyed.